Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm starting a new series on osteoporosis. Osteoporosis is a very common and serious medical problem. In this country, 44 million Americans are affected with osteoporosis. 55% of U.S. population 50 years or older have osteopenia, which is the beginning of osteoporosis. And worldwide, 200 million people have osteoporosis. What's in my hand comes from this book, The Art and Practice of Modern Clinical Medicine, Chapter 77, that I wrote in 2016. Now, different ethnic groups are affected differently with osteoporosis, and different sexes are affected differently from osteoporosis. I'm quoting here from this paragraph. The percentage of whites and Asians are affected by osteoporosis is greater than the percentage of blacks that are affected by this disease. Women are affected more from osteopenia/osteoporosis than men. Blacks have higher bone density than whites do, and as such, blacks have stronger bones and are affected less by osteoporosis. Now, the list of things that can cause someone to have osteoporosis is very, very, very long. In this segment, I'm just simply going to give you an overview. Because osteoporosis, when one just diagnoses it, one has to be extremely, extremely careful. It's not good enough for one to go to some clinic and get bone density test done, and it comes back positive, and you get a prescription for medication for osteoporosis. That could be extremely dangerous because there are many serious medical problems that may first present as osteoporosis. And if one does not follow up and evaluate the reason why the osteoporosis exists, then of course you'll be missing some serious and major medical problems by the time one realizes that it would have been basically too late to do anything for the patient. It is very sad, but what's happening in medicine in this country these days, a lot of folks, I'm one of those people that believe that everybody ought to make a living. This is a free enterprise system. Everybody have the right to make a living. But it is not right, in my view, to have folks with the least amount of experience are allowed to take care of patients, clinical medicine, without supervision. And I'm not going to sit here and list the name of the different folks that are out there taking care of folks in terms of, it just simply wouldn't be appropriate. And I'm not against anything, any of these people, they have to make a living. But to allow these people in an acute setting to be taking care of patients with serious medical problems on their own, without supervision, it just simply tears me apart, because I know, as someone who practices clinical medicine at the highest level for 45 years and teaches clinical medicine for 45 years also at the highest level, it bothers me because I know how complicated, and this is a classic example. When I get through this overview that I'm giving you, you will see the serious medical problem that can first present with osteoporosis. And these folks, many of whom are just being treated for osteoporosis because the bone density is abnormal, and no follow-up as to why they have osteoporosis is being done in many instances. Okay, the list, I'm going to read you the list because it is quite long, okay, of things that can cause somebody to develop osteoporosis. Smoking, alcohol abuse, low dietary calcium, low vitamin D, lack of exercise, malabsorption, malnutrition, postmenopausal state, heparin use chronically, primary hyperparathyroidism, secondary hyperparathyroidism, chronic use of steroid, kidney failure, Cushing syndrome, thyrotoxicosis, calcium deficiency, systemic mastocytosis, rheumatoid arthritis, scurvy, rickets, homozygote osteogenesis imperfecta, heterogeneous osteogenesis imperfecta, hemochromatosis, Marfan syndrome, gigantism, multiple multiple myeloma, etc. Okay. Now, all these, and then of course, it's very frequent that people also look at the other way. People will go to the doctor because they're having low back pain, and suddenly they're evaluated properly in the emergency room setting or in the office setting, and they're found to have kidney stone. Okay, so it is not unusual for them to just be send the patient to a urologist, and the patient get treated for kidney stone, and that's the end of the story. Well, sometimes many times, the presentation of kidney stone also is telling you the reason why the patient is having kidney stone is because the patient has primary hyperparathyroidism that then can cause kidney stone and also can be associated with osteoporosis. The patient may present with, let's say, for instance, osteoporosis, and then it is not evaluated, no other test is done, there's just the bone density and start treating the patient, only to find out the patient has kidney failure. The kidney is failing. Because the kidney is failing, then the patient wind up with secondary hyperparathyroidism, which then causes the osteoporosis. Okay? And the patient comes with osteoporosis, not feeling well, and then go to the subspecialty, frequently a GYN, that do excellent women care. They do bone density, and most bone density are being done basically through this system. And then it's come positive, write a prescription, give medication to treat it, only to find out the patient continue to feel bad. Turns out that this patient has multiple myeloma, which is a cancer of the bone. How about that? Because multiple myeloma can cause patients to have osteoporosis. This stuff is so complicated. I mean, endocrine medicine, endocrinology is such an incredibly stimulating intellectual field. So it is not that simple to just write prescription for patient and say, I'm treating your osteopenia or I'm treating your osteoporosis. That's the end of it. It is not that simple. It is very, 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 very complicated stuff. And of course, as I discussed, you can't be a person who have dark skin, regardless what you call yourself, without having the propensity of developing low vitamin D. 90% of individuals of dark skin, no matter who they think they are, ethnically speaking, are likely to have low vitamin D. To make matters worse, because low vitamin D is a common cause of osteoporosis. I'm just giving you an example, okay? On top of that, 75% of those individuals, Negroes and other folks with dark skin who doesn't want to be identified as Negroes, because if you're a Negro and you live in America, you're supposed to be part of the lower class, and nobody wants to be part of the lower class. So therefore, they don't want to be identified as Negro. Guess what? 75% of such individuals have problem with dairy product. They can't drink milk. They can't eat dairy product because they have lactose intolerance. 75%. 55% of white folks have lactose intolerance. Some 55% of Asian folks also have lactose intolerance, so therefore they cannot tolerate that. Those are cause the people to have low vitamin D. And low vitamin D is a very common cause of osteoporosis. You understand? And the reason is because vitamin D, the first step And the production, first of all, vitamin D is one of the few vitamins that can be produced in the body by itself without taking it in. As you expose to the sun, the skin is exposed to the sun, then the sun ray stimulate the production, start the production of vitamin D under the skin. Well, the darker the skin, the harder it is for the sun ray to penetrate, to stimulate the first step in the production of vitamin D in the body. Then that vitamin D then must find itself into the liver, the D25, and then get transferred to the kidney, and in the kidney turn into D125 so that the body can use it. How about that? So therefore, if you have liver disease, and heaven knows so many people do, you're going to have problem metabolizing vitamin D because the liver is too sick to process it and then send it into the bloodstream to the kidney. So if you have kidney failure, by definition, you're going to have low vitamin D, and you wind up with osteoporosis as well. So this stuff is, I mean, it's intellectually fascinating, stimulating, but extremely important medically. So if you don't know how to do this stuff, you don't understand it, or not very familiar with it, you have to then send the patient who have osteoporosis, that, because go right ahead and do it, but you have to send the patient to an endocrinologist and or to a general internist who's familiar with this kind of stuff. Because frequently in medicine, when you miss the thing, the first step, then by the time that people realize that you missed that stuff, then everybody's scrambling around. Blame is being passed around to try to resolve the issue when it could have been handled several years before. Okay? So I say this to tell you that osteoporosis is not just osteoporosis. Yes, sometimes it's nothing else, because the aging process, the ethnicity of the individual, the diet, all these things can cause somebody to have osteoporosis and nothing else. And believe me, as I proceed with the series on osteoporosis, this is a long chapter. As I finish proceeding, because I'm going to do several shows on it, you'll understand the horrible situation that are occurring in this country and across the world because of osteoporosis. The different fractures, the this and that, the disability, and so on and so forth. This is serious, serious medical problem. And the whole concept of the parathyroid gland, which is a gland that sits right on top of the thyroid gland, what does parathyroid adenoma, if you develop it, can then cause you to have primary hyperparathyroidism. And you can't say, well, I have primary hyperparathyroidism, and then they will need the parathyroid gland, leave some behind, and then that's the end of the story. That is not the end of the story. Or like I said before, you have kidney stone. Kidney stone is not always kidney stone. It is kidney stone. It is very painful, but you must follow up on it to find out what is the reason. It may be because the patient have gout. It may be because the patient have occult hematological malignancy that is brewing slowly and first present with kidney stone, because when you're breaking down the cells of the hematological malignancy, the cell must be broken down somehow. And when that happens, they're releasing a lot of nitrates, and the nitrate then piled up, forming the stone. You pass the stone. This stuff is pretty scary. So it is extremely dangerous to say, well, somebody has osteoporosis, as I stated before, here's a prescription at the end of the story. That is absolutely, totally wrong to do. It is just as wrong for somebody to present to kidney stone and then you just treat them for kidney. Of course you have to treat them for the kidney stone. This stuff is very painful, but they must be evaluated to find out are there other conditions that is even more serious, more dire than the kidney stone that causing the kidney stone. And if you just let that go, because urologists that you're sending this stuff to, they are superb, excellent physicians, but they're not trained in endocrinology. They're not trained in general medicine. And it is not their job, their function, to do all this other stuff. And listen to me, these are not fancy stuff. This is stuff that must be done. I sound like I'm pontificating, but I'm not. I'm just telling you things that must be done for these patients. And if you missed it, by the time you realize that, oh my God, the stone were really associated with something else, or the stone was, how can you justify having somebody coming to you with pain and kidney stone, and then you just send them to urology, not realizing that the reason why they're having kidney stone is because they have primary hyperparathyroidism. How do you go from a stone that's being passed from the kidney all the way to a disease that's located in the neck? Well, that's what it is, quite frequently. And if you miss that, by the time you realize that your patient has primary hyperparathyroidism, he or she has been suffering, and the bones have been washed out, and the primary hyperparathyroidism that's what causes, because the parathyroid hormone level is so high, is bleaching the calcium off the bone, resulting in osteoporosis, also causing calcium kidney stone to develop. Okay? So this stuff is fascinating, but it must be taken into consideration whenever you come in contact with this patient. Now, there are all sorts of fancy stuff, complicated stuff, academic stuff, that I simply will not bore you with when I end the discussion of osteoporosis, because this will be, in my view, inappropriate. If I was in front of a group of medical students, intern and resident, teaching around at a hospital, I would have been required to go into the detail of this stuff, because I have no choice. And what's fascinating about this, you have to understand that, if I may take a minute to introduce you to what really is going on. All major medical centers in this country are being staffed by voluntary attending physicians for no pay. They couldn't survive economically if they had to pay doctors $500,000, $600,000, $1 million, depending on their stature, to teach. So as part of the bylaws of this hospital, certain physicians who are capable of teaching are required to teach pro bono. Otherwise, they couldn't survive. It doesn't matter the medical center, name anyone you want. The vast majority of the teaching is being done by physicians for no pay. The full-time physicians are required as well to teach, but the number is minimal comparing to the vast majority that is needed. And what's fascinating about these colleagues of mine who are in the teaching business at the academic institution, it is demanding, it is brutalizing, because you're going to be walking in on a Monday morning, and the team that you are involved in teaching spend the whole weekend admitting patients, 2 days of admitting patients on your team, and you walk in Monday morning. I mean, you just name the medical problems, the 12 or so, or 14 patients or so that were admitted, it run the gamut. From any cardiac thing you could think of, from any infectious disease thing, from any endocrine thing you could think of, from any type of pneumonia you could think of, from any type of cancer you could think, and you have to walk in, good morning, team, how you guys doing, how was the weekend? And you have to, they start presenting, okay? You have, your hands are empty, the x-rays are there, the EKGs are there, the place to put the x-rays are there, and you're sitting there with 12 or 14 people around you, and they're presenting. As soon as they finish presenting the case, it is your job, the attending physician, to discuss all aspects of that case that was just presented to you from the top of your head. And as you're describing it, you're giving mini lectures on each one of these subjects, each one of the problems that this particular patient is presenting with. You have to discuss it from the top of your head. You have medical students here taking notes. You have intern and resident listening. You cannot imagine how fascinating it is, but that's what you got to do. You got to do it from the top of your head. And then the next patient. The next patient may be a cardiac problem. And you better know every aspect of that cardiac problem because you're going to discuss it. Not only are you going to discuss, you are medical legally responsible for that patient. How about that? If the patient doesn't have a private attending, because sometimes they do present cases that have their own private attending, you are responsible legally, medical legally, for the care of this patient from the time he or she is presented to you until the time that he or she leaves the hospital. How about that? And there is no if or but about it. You are on the hook. And then you're being evaluated. Okay? I can tell you without any arrogance intended, I did it for 25 years at Montefiore. And you're evaluated on known to you every 5 years, you got an evaluation. After the 25 years, the maximum point you as an attending can get using the German system is 6.0. And I left Montefiore after 25 years because I was so sick in 2004 I couldn't go. I received a letter. I was in my dying bed. I was dying. I was on my dying bed. I received this long letter from the chairman of medicine at Montefiore. I had no clue what this was all about. Maybe even if I was not very sick, I could understand the metrics. I mean, list of metric of 25 years. And my friends, my final point, to this day, I still have to put on the paper every 2 years, was a few percentage points from a perfect 6.0. How about that? Okay? Okay? And to this day, when you are filling out your reappointment form, there's a space for you to put that number, whatever that number is. All of us have to do it. Because the way Montefiore does it, Montefiore set it up so that they make you evaluate yourself, grading yourself as you are reapplying. And then that number must be put in there somewhere. Okay? And I did that without bragging for 25 years. But that was a long time ago. I stopped going to Montefiore to teach in 2000. And I didn't go for 2004 because I was on my dying bed. So this is serious business. And this is what's going on across the country. So when I'm sitting here telling you these things, it may seem as though that I'm pontificating. I'm not. I'm just using my own personal experience, and hundreds of thousands of colleagues of mine go through the same process as I sit here talking. So therefore then, the overview, I'm just giving you the overview. I have plenty of time to go over the details with you about osteoporosis, which is fascinating as a disease because can be used to diagnose so many other crucial, serious medical problems, even though itself is a serious problem. So therefore then, as I proceed over the next couple of weeks or so, I'll be explaining to you what are the symptoms of osteoporosis. I'll be explaining to you, as I began to do in this segment, the things that can cause it and how you go about evaluating it and the different subgroups of osteoporosis. A few years ago, out of the blue, evaluating somebody for osteoporosis, I wind up, I think, diagnosed 2 or 3 patients, adult, I think it was 3, adult rickets. Rickets occurs usually in young children that are undernourished because of poverty and what have you. And they don't grow and their legs are a little messed up and all that. 3, adult patient. I wind up diagnosing with adult rickets. How about that? Because the fact that I understand the osteoporosis they presented with was not just osteoporosis. And I was able to do all the necessary tests and come up with the diagnosis of adult rickets. Can you imagine that? Because if you understand this stuff, it is absolutely beautiful. When you're endocrine in particular, oh my God, what a beautiful specialty to know that we are functioning with all these multitudes of glands in our bodies that are interacting with each other to allow us to function well every day. It is an amazing thing. It's an amazing thing. To this day, some of this stuff is so complicated. I refer my patient. And I know this stuff better than I know the palm of my hand. And yet, every month or so, I'm referring the patient to an endocrinologist because this stuff is fascinating, but I'm so busy. I don't want to be the one handling all this little detail. So I refer them to endocrinologists who's much better at this than I am. Even though I teach and write this stuff, I'm still doing it. Can you imagine when you have folks who are not experienced, who don't have the knowledge, and just they're trying to treat this thing themselves just because they can write a prescription to send somebody for bone density, and that's the end of it? Give me a break. Give me a break, okay? I love for people to, I started as a laboratory technologist. Who am I to say people should not start and move ahead? Listen, I'm stopping here until I see you again, this Dr. Alcena saying so long and bye-bye.